This is Dr. Shakil Ahmed. Today I want to discuss the acceleration, an important feature of the color Doppler sonography. It is an important feature of Doppler spectral waveform. Normally, the flow velocity of artery accelerates very rapidly and systole, and the peak velocity is reached within a few hundredths of a second after ventricular contraction begins. Rapid flow acceleration produces almost a vertical deflection of the Doppler waveform. This image shows that here the acceleration is started. The time which it is taken from here to reach the peak, this is called acceleration time. In this acceleration time or rise time should be less than 0.07 second. 0.07 seconds. In this image, we can appreciate the acceleration is started from here and the peak systole is achieved here. So, the time taken by this wave or this peak is 0.03 second, which is within normal limits. In this image, we see that acceleration is started here and that is going up. It is not a vertical deflection, and the time of acceleration is 0.15 second, which is almost double of the normal value, which is 0.07 seconds. So, proximal to the point of the examination, there is some obstruction which is slowing down the acceleration. In this image, we see the normal waveform of the dorsalis pedis artery. While there is severely damped dorsalis pedis artery waveform distal to the occlusion of the common iliac artery and superficial femoral artery. Acceleration is severely delayed. Flow is present throughout the diastole. The reversal part is lost. In this pattern is also called tardus parvus. It indicates that there is proximal occlusion or obstruction or stenosis. Therefore, the wave pattern is changed from the high resistance to the low resistance as the tissue distal to the stenosis is begging for the blood. So this acceleration time is very much prolonged. Quantitative measurement of the acceleration is also possible. We can measure the acceleration time and also we can measure the acceleration index. The acceleration started from here and achieved a peak systolic volume. The time taken from here to here is shown here. Acceleration index is also used for quantitative measurements of the acceleration time. While acceleration index is very much less used in practice, and that is a simple ratio of the velocity, the difference in velocity from the start up to the peak systolic, and a difference between the time which is taken by the acceleration. Thank you.